Hello everyone, and thank you all for attending today's case staffing. Today's case staffing will be pertaining to a patient by the name of Nicholas Underwood. He is a 40-year-old software engineer. He entered an alcohol treatment program with this chief complaint: I need to stop drinking or my wife will divorce me. At the time of admissions, Mr. Underwood stated that he was drinking approximately 1 liter of vodka per day, every day, and had not had an alcohol-free day in over 2 years. For many years, Mr. Underwood had drunk alcohol only after work, but about a year prior to the evaluation, he had begun to routinely drink in the morning whenever he had the day off. More recently, he had begun to feel shaky every morning and would sometimes treat the sensation with a drink, followed by more alcohol during the day. Mr. Underwood had experienced a number of problems related to drinking. His wife was at the end of his rope and was considering divorce. His diminished ability to concentrate at work was sinking his once promising career. He was spending more time trying to recover from the effects of drinking and found himself both planning strategies both for abstinence and for surreptitiously taking his next drink. Mr. Underwood first tried alcohol in high school and said that he had always been able to hold his liquor more than his friends could. In college, he was one of the heaviest drinkers in a fraternity known as Animal House around campus. Through his 30s, he gradually increased the frequency of his drinking from primarily on the weekends to daily. Over the prior year, he had switched from being exclusively a beer drinker to drinking vodka. He had gone to many Alcohol Anonymous meetings over the years, but tended to drink as soon as the meeting ended. He had received no formal treatment. The patient denied recent use of other substances. He had smoked marijuana and snorted several times during college, but never since. He had used no other illicit drugs and took no medications. He did not smoke cigarettes. He experienced blackouts on several occasions during his college, but not since then. He had no history of seizures and no other medical problems. Family history was significant for alcohol dependency in his father and paternal grandfather. Mr. Underwood entered the alcohol treatment program at approximately 3 p.m., having not had a drink since the evening before. He was diaphoretic and exhibited significant tremulousness in his hands. He complained of anxiety, restlessness, irritability, nausea, and recent insomnia. Client evaluation revealed a casually groomed diaphoretic man who was cooperative but anxiously pacing, and who immediately said, "I'm getting ready to jump out of my skin." Speech was at normal rate, rhythm and tone. He denied depression. There was no evidence of psychotic thinking, and he denied auditory, visual, or tactical hallucinations. He was alert and oriented to person, place, and date. He had no gross memory deficits, but his attention and concentration were noted to be reduced. Notable features of his physical examination were marked diaphoresis, a blood pressure of 155/95, a heart rate of 104 beats per minute, severe tremulousness in his upper extremities, and hyperactive, deep, tender reflexes throughout. Laboratory tests were within normal limits, except for aspirate aminotransferase and alanine aminotransferase, which were approximately 3 times normal. And I would like everyone's feedback on what the diagnosis may be.
Are you political, Mr. Gaines?